How noticeable are thigh lift scars? Have you ever wondered how noticeable scars from a thigh lift surgery really are? This is a common question for those considering this body contouring procedure. Thigh lift surgery is designed to remove excess skin and fat from the thighs, which means incisions are necessary and scars will result. However, the visibility of these scars can vary quite a bit based on several factors. First, the type of thigh lift performed plays a significant role. For instance, a mini thigh lift involves a small incision that is hidden in the groin crease. This results in minimal scarring that is often well concealed. On the other hand, an inner thigh lift leaves a scar that runs along the groin crease and may extend down the inner thigh. If a larger amount of skin is removed, this scar can be longer. Then there are more extensive procedures like the vertical or medial thigh lift, which may requiring longer scars running down the inner thigh. The spiral thigh lift is another option, which involves incisions around the buttock crease and along the front of the thigh, leading to more extensive scarring around the thigh circumference. Immediately after the surgery, scars are usually red, raised, and more noticeable. However, with time, typically within 6 to 12 months, these scars tend to soften, flatten, and fade significantly. They become thinner and paler, but it is important to note that scars rarely disappear completely. Their visibility can depend on individual factors such as skin type, genetics, and how well post-surgical care instructions are followed. This includes moisturizing the area, protecting it from the sun, and avoiding smoking, which can impact healing. Plastic surgeons often aim to minimize scar visibility by placing incisions in natural body folds or areas that can be covered by clothing or swimwear. This strategic placement helps make scars less noticeable during daily activities and when wearing typical clothing. In summary, while thigh lift scars are an inevitable part of the procedure, they can be discreet and fade significantly over time. The extent of the lift and the amount of skin removed will influence how long and noticeable the scars are. With proper surgical technique and diligent post-operative care, scars usually do not detract significantly from the overall aesthetic results of the thigh lift procedure. If you are considering a thigh lift, it is always best to consult with a qualified plastic surgeon to discuss your specific situation and what you can expect.